It's HIMSS 2019 right here from Orlando, Florida, as we welcome you to CommonWell TV. Scott Adams here with you as we're introducing you to some of our CommonWell Health Alliance members. And now being joined by a longtime member of the CommonWell Alliance, that being eClinicalWorks and their Director of Interoperability, Navi Gadhiok. As Navi, why is interoperability so important to eClinicalWorks, and how does that drive your involvement into CommonWell?
So eClinicalWorks, being primarily in ambulatory healthcare, it's very important for us to participate in nationwide initiatives like CommonWell Health Alliance so that our providers could access their patients' records easily. Now, we're in a world where patients don't care. They just end up going to any provider's offices to seek care, and regardless to what EHR systems are being used in doctors' offices. And for a provider to provide the highest level of care, it's very important for them to have this clinical data at their fingertips. Ever since we've made connection to CommonWell available to our customers, we've seen over 20,000 physicians already connected. And with those 20,000 physicians, we've seen over 1.3 million inter-member links for the patients that's contributed to the network. So the numbers itself shows us how important and value add it is for our providers to be connected to the interoperability initiative and take advantage of that. And so we've also engaged our provider organization with the joint efforts between CommonWell and Care Equality to improve the CCDA content. And we are absolutely with our providers to help them achieve this goal. And you would see this, the changes are already reflecting on our product side of things as well, where providers are able to take advantage of features like Prisma to easily manage the content that is coming in from these different sources.
Yeah, being able to provide and coordinate that data for your providers, it must be a world of difference for them, is it not?
It is, absolutely. It is.
Yeah,
it is.
It's impressive. As you know, interoperability with CommonWell, here you guys have been such a long time member. Is there maybe an instance or a highlight that really sticks out during your guys' time as members that you'd like to perhaps share?
Sure. So as we all know, physician burnout is a big issue in the industry right now. And there are talks about it. There was a Stanford study recently about it. We strongly feel initiatives like CommonWell help alleviate this problem. And prior connecting to CommonWell, physicians' offices used to spend hours trying to get access to clinical records of the patients. Now, CommonWell in the picture, the information is right there at the fingertips. It's not time consuming at all. The patient comes in, the provider is able to initiate a query and get access to that data. So it's absolutely helping them kind of stay away from that physician burnout, and they could provide better care to their patients.
ADT notifications, enabling those so your clients are able to get those quickly and really kind of tying in the network, and CommonWell is able to provide that.
Right. So prospective for ADT notifications is going to be, I think the benefits are going to be huge. I personally travel coast to coast for interoperability showcases, road shows, and it's a very common question that is brought up by the providers or clinicians. They want to know where their patients are, specifically the chronic patients in emergent situations. The only way this is possible is if we start receiving hospitals notification directly into the EHR. So if CommonWell is not kept in the equation, this would take us to build a point-to-point integration between the hospital and the practice, which would not be a cost-effective model, and it's not a scalable model. When we bring in CommonWell to this equation, it acts as a hub where there are already hospitals, practices participating, and it's just a matter of providers just enrolling into the service so that they could receive real-time notifications, and they have more time to act upon these notifications.
On that same note, improving care coordination and delivery outcomes, those ADT notifications are going to be such a valuable asset, no?
So we feel it is absolutely going to be valuable because, as we know, hospital readministration is a huge issue in the industry right now. Providers are concerned about patients getting to the ER and then getting readmitted again. So having notifications come into a provider's EHR is definitely going to help them solve that issue. So once the provider has the notification within their EHR, they have more time to act on it, to follow up, and schedule a follow-up appointment with the patient. And to reflect this within our products, we have a whole TCM dashboard which helps them basically manage the transition of care module. It allows them to see the notification, and it allows them to follow up with the patient in a timely manner so that they could have better treatment plans for the patient and avoid that readmission to the hospital.
Ease of access, it's incredible stuff, and coming into the future, it's right here at our fingertips. One of the founding members of the CommonWell Alliance, that's eClinicalWorks, and for more on them, we invite you to log on to CommonWellAlliance.org. Thanks so much, Navi.
Thank you.